Hey Pusino, Pussinet, new little video. On this one, it's a request about gas gangrene infection. So what is that gangrene stuff? First of all, there you'll see if you do some research and reading, and actually, let's start with a warning too, is that what we're going to talk about, some of the stuff is surgical, so you need like a surgeon and to do. We talk about that before, of like if you everything that you do, you have to decide if you're willing to do it, if you feel comfortable to do it, and just watching a YouTube video doesn't mean that you'll know how to do it either. Those are just more my opinions and stuff that I read, and even a lot of those skills, I did have some basic training, but I'm not a surgeon of any kind, so it's more like the readings, and if I would have to do something, then I would have to take the decision. And also, I would like to send you back to palliative care, because some of those patients will take a lot of your resource, as well as the chance of survival may be kind of limited. So if you're limited on some of your resource, those could be the ones that you will kind of put more in a palliative treatment branch than full-blown treatment. So let's start with that. So we were talking about gas gangrene. That was the main question, but we'll kind of expand a little bit on it to kind of make a better thing. So gas gangrene is an infection, but basically that happens in your body. And different cause can create it. And actually, I'll have a link on an article that was actually very good about it. And what's interesting, it won't make much difference at the bedside. So that means like at us for the more medical reason, because we're limited in the resource that we can have. But in the medical community, it makes difference between gangrene, gas gangrene, or necrotizing fasciitis, necrotizing cellulitis, and those can all look the same, but they have different reason to be, and they can also have different treatments. So it's really important it's not so much important for our talk, but you can understand that there's a whole bunch of stuff. But if you read on gas gangrene and complication, a few of the articles that I'll will bring a little bit more stuff to read, and hopefully it will clear up stuff a little bit. So basically what happens is that an infection can go in, and we'll talk mostly like fractures, so traumas, crush injuries, and things like that. And then the second one will be more like skin, because you can, even just with a bad wound that goes bad, things can happen like that. So fractures, when you start treating, you always want to know if a fracture is closed or open. And the reason for open is that it breaks the skin, and so there's more chance of going inside of those complications. And during the Civil War, that was one of the main reasons they did so many amputations. So it's what we call life over limb in some of those cases. Is that what would you rather have, all your 4 limbs or your life? So that's why they were doing amputation. So in some cases, if you don't treat those, they will sneak up on you and basically will go across your body, and you'll have like a bad sepsis. Well, as I was thinking about looking at pictures from the kits they used to have for amputation and of bone fractures, they look a lot like the kits that they sell now for when you open. And I'm not a hunter at all, but they look a lot like the kits that they use for opening animals and carcass and stuff, which makes sense because they're bones. So bones, they're bones. So I thought actually I may even think about looking at buying one just to look if some of those tools could be useful for that. So again, I don't recommend you to start doing surgeries on everybody, but if you have to, then you have the tools over there. I'll put one video more like the improvised version of it, because the other ones is most likely won't have those tools, but it's actually a cool video how it's done. And again, I'm not saying you should be doing it or not doing it. That is your own decision, and that's why I don't demonstrate any techniques here. But that would be one. So if you have a fracture, a lot of time you have a cast. And the problem with the cast, though, is that you close the bones inside. You hopefully that they will be stables, but it's very hard to assess it. And if you have fractures and like open wounds, how do you can assess and everything? So last time that I went to the conference on wilderness medicine, they were talking about this little kid, and actually we practiced about it. And all it is what we call external fixations. So what external fixation is basically, if you have a bone like this, what you do is, as you see the holes here for practicing, so that's why I have this bone, and I don't play with it or anything, but what you do is, as you can see here, those little bits there, they get drills inside, and this, where is it? There you go. So that thing here, right there, is for to drill. So as you can see here, so all that bar is basically to drill, and as well as then you can switch it, and the tools becomes what you use to tie up those ones. So with one, actually with multi-kits, that means you can, so this you could probably maybe do an arm, but if I have 2 or 3 kits, then I can do maybe a leg. And that's what they were talking, is that when they went to, and I'll put a link about where you can find that stuff and find more information, because you can buy them on YouTube, not YouTube, sorry, eBay, and that's why I got it. They were pretty cheap because they came with a better version of it. So, and yeah, so they were talking about when they went to Haiti. That's what they were using. So they were using those things to do external fixation. The advantage of this versus the others is versus a cast is that you can still monitor the skin. You can evaluate if any complication are happening and things, and you can intervene a little bit quicker than if you have everything under a cast and then you lose your stuff. So the complication that you can still have with those are gangrene, but the reason is more the gangrene is not. It's a skin, so you need to take off that skin, which we call debridement. So that means that surgically you kind of literally like scoop the stuff out, and to try to keep it the good material alive. And then when there's more black stuff comes in, you still scoop it again until you have a very good skin. If you have a fracture, the problem is that now this infection can go into your bone. It's called osteomylitis, and the problem with the infection or the inflammation that goes into your bone is that now you also have a lot of vascular circulation to your bones. So as our bone is actually, you can kind of see over here, that's what they showed. So we have like a little spongious substance inside, and there's a lot of vasculation. And one other treatment that you may have to do is, like we were talking about, amputation. And so what amputation will do is that because the bone is fractured, or you'll try to cut it off. And I'll put a video on what to do and different techniques to use. Actually, in the book, they even talk about using carpenter saw, sharp chisels, straight gouge to cut the bones. Very rudimentary. The important part after that is to try to keep enough skin so that you'll protect the bones to have a skin flap. If you're going to do and again in the video they'll explain to you how to do it and stuff. And So now then the treatment is, what do we do with this? Honey. Honey could be used on the wounds to cover, because they talk about treatment from the readings that I had of topical dressings. So honey in the previous, during the Greece and the Roman, that's what they were using for some of those battles. So if they had like slash from a glaive or a spear, that's what they would use. So could be used. Also in second, I'll put a link on an article that could be interesting. So maggots is used, but usually those are sterile maggots. Obviously, don't confuse that in the medical field. They don't just go in the outside and use some maggots and put it on there. The advantage of the maggots is they'll eat the bad stuff and they'll leave the good stuff in. So it is some sort of debridement, I guess, in a situation that could be used. Because basically what you want is that necrosis to go away. On this matter as well, the big question was, should we use things like betadine and alcohol? On some of the readings, I mean, we used to do that in the past. So if people would showed up with osteomylitis so if you had like someone with diabetes, foot that kind of have a big ulcer and you have the skin on it, they'll use betadine sometime when it's in a chronic wound. And the reason that they'll use that is that, again, you're not trying to save the wound, but you're trying to prevent a bigger complication called osteomyelitis. So what happened is that betadine, like we were talking before, is not good for acute care wounds and stuff, is that it will dry up and create this crust. So that's why it's not good for wounds. But if you have a chronic wound, so if you have like a foot, like a diabetic foot, and you have like a bone, so what's going to do, it's going to create this callus or this hard skin. And it looks like almost necrosis. It looks black, but it's a different type of skin. And what it's going to do is going to prevent infection to go in. So in some cases, it could be used. But I would go with the other treatment before, so like honey and silvers. So the Aquacel AG that we were talking about, that could be used as well for some wounds. In some of the readings that I was doing as well, they were talking about not having full closure of your wounds unless you're pretty sure about what you're doing. One complication as well that can come from this is what we call compartment syndrome. And basically compartment syndrome means that your muscles is a whole bunch of so if you would cut a muscle, so if I would take my arm basically and cut it and therefore put it in a microscope, it's not one piece. It's different, basically all around piece that kind of creates this whole, and all those are compartments. And surrounding those is what we call the fascia. And what happens is that sometimes the compartment, there's enough pressure that could be that can compress the nerve, compress the vessels that goes through it, and what's going to happen is the compartment syndrome. So basically in the compartment there's so much pressure that you're going to have compartment syndrome. And one of the signs and symptoms initial for gas, gangrene, all those things is more pain than you should have. So if you have a wound or if you have a fracture, it is painful. But if you just like touch it and it's like they're screaming, they most likely have the compartment syndrome. The late sign that most people are more aware of is more like loss of the pulse and the paresthesia, meaning that you don't feel any more of sensation. Well, the problem with this is that by the time it's there, is that the compression is very, very, very advanced, and so now you have lost the pulse and you have lost the nerve in your fingers. So the treatment for that is fasciectomy, and I'll put a link about that. So so using those products, sure, you can try to do it, because again at this point you're not trying to save a wound, you're trying to save a limb, or actually a life, and try to prevent the life. So hopefully with all those little extra links you'll have enough information. Talk to you. Cheers.